Piriformis stretch. So to stretch the piriformis appropriately, yoga has a yoga pose called the pigeon pose that is really effective. However, because most people's hips are so tight, they can't adequately do it on the floor. So my favorite thing to show my clients over the years is to do this on an elevated surface. Now, this could be a bed, it could be a countertop, it could be any kind of an elevated surface that allows you to have the appropriate body position so that you can get deep into those hips, and especially if your hips tend to be really tight. So what you're going to do is bringing your leg up onto the table or the bed, whatever you're using. Now the key, real quick, whatever side you're stretching is the leg that's up. So if I'm stretching my left leg's up. If I want to stretch my right leg, then my right leg would be up. So to start, the important setup is that your leg needs to come straight out of the hip. So your knee should be in alignment with your hip. Second, your shin should be parallel to you. So a mistake that a lot of people make is they bend their leg like this, trying to stretch their piriformis, and it's not going to help. So you keep this leg out in front of you like this. Another mistake that they make is that their foot is in front instead of their knee. Now, a lot of times when people are getting into these stretches, by not having the right framework set up, they end up hurting their knee because you're torquing the knee rather than actually stretching the hip. So knee is straight in line with the hip, shin is parallel to you, and now you need a 90-degree angle in your foot with your toes pointing away from you. Not pointed, keep the toes up. So you have a 90-degree angle here, 90-degree angle here, 90-degree angle in your pelvis. Now that you're in this position, you're ready to go. Now, if your hips are really, really, really stiff and you're up here, it's the same. Knee needs to be in front of the hip. And as you start to get more and more flexible, you're going to see your knee is going to come out. That's where you just adjust your body so that you're staying in that right alignment. So step one is a static stretch. You're holding your stretch for at least 1 to 2 minutes or until you feel it let go. But a lot of studies are going to show that the deepest tissue in that hip isn't going to let go for at least 1 minute to 2 minutes, sometimes even longer. So if you're really stiff, be patient and really get that hip to start to let go. Now, step two is we're going to do the Pale's contraction. That Pale contraction is going to be pushing your foot through the floor or the table. So in this position, you've found your stretch. And one side note that if you can get your leg all the way down, now you start pushing your leg behind you, keeping your spine straight, and you can start to lean into this. Another piece that starts to happen is people's pelvis shoots out. Make sure your pelvis is square. So I did my stretch, 1 to 2 minutes. I'm good and I'm ready to go. Now what I'm going to do is I'm going to push my foot through the table at 20% effort, 40%, 60%, 80% effort. And as long as there's no pain, I'm going to go for 100% effort, trying as hard as I can to push my foot through the table. After 10 seconds, you relax. And what you're going to notice, you can go a little bit deeper. Do the contraction again, 10, 20, 40, 60, 80, 100% effort if you can, as long as there's no pain. And then you're going to do it a third time. Now, once you're here, the rails contraction is to lift your foot off the table. Now, in this position, I don't have that active control in this deep range of motion of my hip. So what I'm going to do is I'm going to slowly come out of it until I can lift that leg up. And it's about right there. And you hold this for 10 seconds. And then you relax. And that's your piriformis stretch.